An 8-year-old boy comes in due to swelling in his extremities and face. Exam shows soft tissue edema, and urinalysis shows proteinuria and electrophoresis. Which fraction most likely has the protein that caused the edema in this child? So you have the 4 fractions listed here, and this is actually the fraction electrophoresis of a normal patient. So what fraction has in this electrophoresis has the protein that caused the edema in this patient? I'll let you answer the question and then I'll explain in 5 seconds. Okay, so the answer is going to be A, fraction A. So for this question, we have a patient coming in with nephrotic syndrome, and that's defined as proteinuria with greater than 3.5 grams a day. So they present with low albumin that causes decreased oncotic pressure that causes edema. So for this one, you have to understand for nephrotic syndrome that the patient, in this case typically a young male, is going to lose a lot of protein in their urine. So this causes decreased oncotic pressure, which is the pressure induced by the protein in the vessel. So if you have a lot of protein in the vessel, then it allows that protein to draw on water and therefore keep water in the vessel, which is good because therefore you can maintain blood pressure and maintain perfusion to the extremities. However, what happens in this case is because you don't have that albumin, now suddenly you don't have oncotic pressure, and now the water doesn't have a force pulling it into the vessel. So you're actually going to have water stay in the interstitial space and accumulate there. And so that's how you get this soft tissue edema, both in the extremities and classically in the periorbital space. So for fraction A, since this electrophoresis is a normal person's electrophoresis, you're going to have a spike here in A versus a normal, or in this patient, the patient with nephrotic syndrome, who would have an absence of this spike, because fraction A usually has albumin, fibrinogen, and globulins. Now, for this patient, if they don't have albumin, then this fraction A is going to be decreased. So this question was essentially asking what is different between this patient and a normal patient. And so that's going to be fraction A. And so for the other ones, fraction B is going to have alpha-1 globulin, fraction C doesn't really have anything significant, and then fraction D is going to have alpha-2 globulin fraction. So really the biggest one is going to be fraction A, the most important. So once again, just explaining that this patient is coming in with nephrotic syndrome, and they're comparing this patient to a normal patient's electrophoresis, and the one difference that they're going to have is going to be fraction A. So this patient will have a low fraction A versus a normal patient who's going to have a high fraction A. So I hope that helped, and thanks for watching.